Rahim Ullah, a Rohingya refugee, is getting a medical exam. He's 62 years old and a diabetic.
When I suffer from my diabetes, I feel my lips are drying and feel thirsty as well as pain across my whole body. I become restless and cannot sleep.
He receives a free evaluation and medicine at this hospital run by Médecins Sans Frontières, also known as Doctors Without Borders. This is one of about 180 medical centers that have opened since late 2017 to take care of more than 700,000 Rohingya Muslims who fled to southern Bangladesh from neighboring Myanmar. It's because of a military crackdown that United Nations investigators have said was executed with genocidal intent, accusations Myanmar denies. The refugees now live in overcrowded camps, and the poor living conditions contribute to many health problems.
The poor living conditions in the camps are the leading cause of many multiple illnesses, including diarrheal diseases, skin diseases, respiratory infections.
Toilets shared by many families can become filthy. There are times when clean water is scarce in sections of the camps, making it difficult for some refugees to find a place to even wash their hands.
When this crisis started more than a year and a half ago, there was an immediate need for emergency care to take care of refugees with wounds from bullets and knives. There were outbreaks of measles and diphtheria that needed to be contained. But as things have stabilized and this has turned into a prolonged crisis, medical teams are scaling up resources to take care of the refugees' long-term health care needs.
Medical teams say there's a lot of demand to help refugees with chronic issues such as diabetes, high blood pressure, as well as patients with constant pain, such as Abdu.
I feel good because they made me walk and tested my blood. They give me medicine and treat me well.
So we assume that in the coming future there will be a big need in providing care to respond to these chronic conditions that people are living with.
The medical teams work under tough conditions. The examination rooms in this outpatient center are small and separated not by walls, but by tarps. While Rahim Ullah is being examined, you can hear a patient in a nearby room shouting in pain. Nonetheless, the doctors, nurses, and medical assistants will keep at it because so many refugees are depending on them. Dave Grunebaum for VOA News, Cox's Bazar, Bangladesh.